Well, today on the show, we're at Gulf Coast Knee Pain and Neuropathy Center in Biloxi on Pass Road. And we're talking to some of the great folks that have had some great success on getting relief from Dr. Mitchell here. And one of them is Laurel Wiley. How are you, Laurel? Good to see you.
Just fine.
Tell us what brought you here to Gulf Coast Knee Pain and Neuropathy Center.
Well, my wife and I, we got an invitation to go to a dinner one afternoon, and we went to it. And I didn't know anything about neuropathy, so I figured, well, I'll learn something, because she had already been told by doctors that they couldn't do anything for hers.
Really?
And we sat there and we listened to about a 40-minute spiel on what neuropathy was and how it could be treated without medications.
And you pretty much, the light went off, that's what I got.
Yeah, and I knew I was having burning sensation in my feet.
What was some of the other things you
Only
had
at
difficulty
night.
doing?
And that's the thing that bothered me, is if it doesn't bother me when I'm walking, why does it bother me at night and keep me awake? And my wife told me, she says, well, you got neuropathy in your feet. So, of course, we went and we sat there and we listened to people that were throwing questions at Doc. And
How long were you suffering from this condition?
probably 3 months before we went.
Did you seek
No.
other treatments before that?
No, none.
No.
None. My wife, though, she had gone to doctors and they wanted to treat it with all kinds of medication, and she's already taken so many that she didn't want to take any either.
Right. Yeah, it gets to the point where those medications just don't work anymore. Your system gets used to it.
Right.
So,
well, it cooks your nerves in your brain.
Oh.
That send the...
which is basically
I'm
what it
having
does.
problems to your feet or to your legs, wherever it's bothering you.
So what percentage would you say has improved with you since you started coming to Dr. Mitchell here?
I've had about a 95% improvement.
Wow.
I might have burning in my feet once or twice a month instead of every night.
That's a big difference.
That's a big difference.
Very big difference.
And he's told us it won't cure it, but it'll delay it.
Delay it and
From doing
definitely give you some relief, which is a big thing.
Yeah.
All right.
And we don't have that many years
I
to
wouldn't say that.
delay it, you know,
No, I
before
wouldn't say
we're
that.
delayed anyway.
Hey, people live way over 100, so I'm sure you got plenty of years left. Well, Mr. Wiley, thank you so much for being here. We want to talk to somebody else who's got some great relief from Dr. Mitchell. Another gentleman that came to see Dr. Mitchell is Mr. Polk. How are you, sir?
Oh, great.
Good to see you. What kind of problems were you having that made you come to see Dr. Mitchell?
Well, I was having balance problems, and then I was having pain and swelling in my feet. And I was told by the doctors that, you know, they didn't have any cure for it because I had neuropathy. And so I decided to come to see Dr.
Mitchell,
due to the fact that I saw him on WLOX.
Oh, we like that.
Right.
We like that. That's awesome.
Right.
Now, you know, they say there's no cure for neuropathy, but you definitely are getting relief from it.
Great relief. I mean, I'm thinking about 40%.
Wow. How long were you suffering from this condition?
I've been suffering from neuropathy for the last 10 years.
Really?
Yes.
Wow. Did you seek any other treatments before coming to Dr. Mitchell?
Yes, the only treatment I got was they gave me a cane and a wheelchair. And that's
That
what
doesn't
they said.
seem like treatment to me.
No,
To me, that sounds like a patch.
it was.
Just basically, they gave you something to kind of help relieve it, but it's not going to help the actual neuropathy itself.
Right.
That's something. And you said probably about a 40% improvement
Yes, it was.
as to what you had?
Yes.
Okay. And how did you find out about Dr. Mitchell?
Through WLOX.
Oh, that's right. You told me that. Well, we're going to talk to Dr. Mitchell and share some of the other great things and delve a little bit more into neuropathy. So, Mr. Pope, thank you so much.
Right.
Appreciate you coming and being on here with us today.
Right. Thank you.
Great testimonials from Mr. Wiley, Mr.
Yes,
Pope,
sir. Yes,
about
sir.
how you help them out with neuropathy. And neuropathy is something that affects a lot of people, and they're looking for ways to get relief. What do you do to try to help them out?
That's a good question, Jim. Initially, we have to describe what neuropathy is. We have to really pinpoint what's the definition of neuropathy. A lot of these patients that come in here, they have no idea what neuropathy is. So simply put, neuropathy is a lack of blood flow to that nerve. Okay, so there's two types of nervous type problems within that nerve. You have a sensory component of that nerve and you have a motor component of that nerve. So if you have a lack of blood flow, such as if you're a type 1 or type 2 diabetic, there's a multitude of other problems with patients that present here. They can have chemo-induced neuropathy. They can have, like I said, diabetic neuropathy. Drug interactions have a problem causing neuropathy as well. So,
really?
So yeah, so it's a lack of blood flow. So when we see a patient, we have to do an evaluation on them, do a nerve test. A lot of these patients come in, they've already had a nerve conduction velocity test, which as some of these patients will tell you that's very painful. So we have to do an evaluation, find out what kind of neuropathy they have, and then determine what course of treatment we can do, okay? So, but we do have multitude of things in here, not just a cold laser, not just a PMF machine. We have multitude of things to get these patients well.
And everyone's going to be different as far as, you know, as what you may do if I had neuropathy, as opposed to, you know, what a woman has to have done.
That's right, that's right. There's not a cookie cutter program for everybody, okay? When they come in, we have to sit down with them. Everything's the same treatments, there's not a same treatment protocol for each patient. Every patient is different. This is why we only take these patients and we have to evaluate them. That's the number one thing. So they can come in for $89. Anybody that's watching, for $89, they can come in. We'll do a full body evaluation on them, a nerve evaluation. We'll even take some x-rays of their lower back because we have to take a look at that spine as well. So we'll do an evaluation. If we feel like that their condition is too far gone, if it's 85% or greater, we cannot accept them as a patient. So we'll shake hands and part our ways.
Well, I mean, that in itself is amazing, because the fact that, you know, I'm sure there are physicians around the country that they'll want, you know, say, hey, yeah, sure, I can do something to help you out and take your money and all that. But the fact that you're going to be honest with them and say, I'm sorry, I can't help you.
Yeah.
I mean, that's.
And there's been patients walked in here and they've literally cried thinking that we can help them. But we will not waste their time. You know, there's two things that I have to protect. I've got to protect their investment, and I got to protect my reputation.
Right.
So those are two things that we look at. So when we sit down with them, we let them know right up front what we need to do.
And that's why you have such a great reputation.
Well, we would like to think so.
I hear a lot of good things about you.
And
I get calls from people all the time, you know, who's the doctor that you had on there talking about, you know, the neuropathy and getting all that. He's in Biloxi. And, you know, I give them the number and tell them, give you a call.
Well, we appreciate that.
Well, definitely. Good to see you again.
Nice seeing you too. Thank you.
Again, if you give them a call, you can go on their website, you can go on their Facebook page, get some more information, and set up an appointment and let them do an evaluation if you're dealing with neuropathy and see if they can help you.